Thank you guys for joining me and us today. I'm glad to be here. Today we will look a little bit closer as a biorevitalization with INNEA products, and we will dive a little bit deeper into the INNEA Aqua protocols, and we will talk about trehalose and a little bit about hyaluronic acid, what we all know. So I will not be too slow. We all know a lot. You guys are really experienced, that I already understood. But it's also sometimes good to hear from another angle what the other specialties or the other specialists working with. So, a brief background about me was already a lot told. I'm from Germany. Wiesbaden is not far away from Frankfurt. So if you are there, please come in my practice. It's about 30 minutes from Frankfurt. I started my work in America as a dermatologist, my residency, and then 8 years ago I moved to Germany and working there. I have 2 jobs. I have my private for aesthetic dermatology, more aesthetics, and I'm also working with a normal insurance patients in a dermatological practice where I make my surgeries and see just a normal dermatological classical patient. So I try to combine it all. And also I have this opportunity to see the doctors from all over the world for the International Medical Training Academy. I find it really cool because it's not only me who is sharing my experience. I'm always asking a lot because I find it's really important for us doctors to be connected, not to find each other like, opponent. We are all colleagues. We need to be collegial. We need to share. We need to tell each other what can we do better for our patients and for good of our patients. So, INNEA. You know already INNEA is a cutting-edge approach. It's not only a product or a line of 3 products. I don't know, do you know all 3 products, or how do you work here with the INNEA product? Do you know only Aqua, or you know also Evidence, or the classical one? Aqua. There are actually 2 more products from INNEA. We will talk a little bit about this today because in my practice I combine the products, and this combination we can sell is a full spectrum combination. Why? Because every product, at least Evidence and Aqua, have a different molecular weight of hyaluronic acid, which helps me to combine them safely and which helps me to go on all the receptors in the skin that are sensitive to different molecular weights of hyaluronic acid. So we have these 3 products. The first one, the basic one, was the classical INNEA. Then they have Aqua, which you know, and the last one is the Evidence. We will go through them all, and I will share my experience, how I work with INNEA, how I incorporate it in my praxis, and why I do this or that. Maybe it will help you guys also to somehow lift your practice. Maybe this is what your patient were waiting, and maybe you didn't hear about this, or you didn't realize what are the specific things about the products are. So hyaluronic acid, I don't want to be talking too much about this. It's a core building block. We all know, we all have it, but we all need to know that over the time, hyaluronic acid will be going away from our tissues, so we will need to replace it. And here where we need to start about the replacement therapy. One replacement therapy is not the same with another product as with seemingly the same product. So here is the core thing. We have, you probably all know this, I go really roughly, different types of hyaluronic acid replacement therapies. Depending on the molecular weight, we are having 3 big groups. Of course, you can do more, but anywhere is it. So the lowest molecular weight of what we can get, what it does, moisturizes, detox. This is what we do superficially. The medium is a stimulation of regeneration, hydro reserve. Also, you know, like somewhere in between, we can do a little bit hydro, but we're also starting to stimulate the cells. And the highest molecular weight is, of course, the lifting, the boosting, everything that we want to create. We boost the collagen, we boost the angiogenesis and neocollagenesis. This is really about the density of the skin. When we talk about the lowest weight, it's about hydration, the highest is the density. And this is what is cool when you combine the treatments, or you have maybe one product where you all molecular weights can be present. So you can, patient can benefit from all the sides of this hyaluronic acid treatment. So as you all know, we have cross-linked and non-cross-linked forms of hyaluronic acid, also in different biorevitalizants. What do we have? The cross-linked, we all know, they are staying longer, they are contouring, they are resistant to enzymatic breakdown. It's all perfect, we all know this, but they are volumizing rather than revitalizing. This is important. You know, there is no revitalization in non-cross-linked, or uncross-linked, sorry. What is the downside about this, or the disadvantage of this? Sorry, because I have two things here to see what the next is. So the disadvantage is inflammatory reaction because of a film that is in a cross-linked formulas. And because of a visualization and adverse effects. So if you are good with this, if you know what you're doing, if you are sterile, your hygiene is really high, actually you don't have any problems, but we all need to be aware of this different side of cross-linked forms of biorevitalization. And then we have non-cross-linked. This is a little bit purer, and that's why the adverse effect, like inflammation, is lower. Of course, fast clinical results, yes, because we inject it superficially, for example, and we see directly that it's already plumped. And what I like is also that it's a much wider range of usage you can have here. You can use it in some cases with dermatological patients who experience scarring, or you can use it by rosacea patient, hyperpigmentation, knowing the right product. That's the thing. So, and of course, rehabilitation is really fast, so we can work without any problems and explain our patients how it's all possible. The production of hyaluronic acid, it's usually a bacterial production, so they do a streptococcal fermentation. It's a recombination product, and it is important to understand, because of a purification and all these steps, there could be good and bad products. That's why sometimes price depends on the quality. Maybe the purification is a question. And it's a really perfect source for the bacteria to get their nourishment. So you need to be careful what you actually use. Price, most of the time I find, also makes sense. Why is it? And so how do they do this? This is a nutrient medium, seeds and air. They cultivate and then separate. So the more steps there are, the higher the risk of the mistake. And mistake is a purification of a product. What we need to say about the INNEA, they're using products of bacteria Streptococcus equi that are non-related to animals. That's why they are not pathogenic, and that's why this purification grade is not, is of course important because it's really high purified, but it's very important because of a non-animal production. This side effect is already away because it's not from the animals. It cannot cause any adverse effect in that way. So interaction of hyaluronic acid with the tissue. Of course, hyaluronic acid doesn't just sit in the tissue. It in the skin, it interacts with the skin. What does it boost? Physiological process of regeneration, epithelialization. We all know this, it's nothing new. And what if we use a trehalose? What is this such a cool thing? Why should we use it, and what do we get from this? So trehalose helps us to create like a protection layer, so the hyaluronidase cannot get to our product that fast, so it lasts longer. Plus, it, let's say, so recovers the cell around itself. Why is it good? Why is it important? The patient with rosacea. There are really sensitive patients, and when the product is recovering the tissue around himself, it's already having a little bit of anti-inflammatory factor. The patient with hyperpigmentation, they will be, all this rubber that we have in our skin can be replaced or recovered from the tissue. So we explain this patient that over the years, it is important. I always explain my patients why I take this or other product. Over the years, we inject all the time. We inject without end. I don't know if you have these patients, they want to come every month. They want to be injected and this, and can you inject this and this and that? And then they have under their skin, it's like everything is there. And are we sure that our body can cope with this? Are we sure that our body will not accumulate this, and that's why our patients in 20 years looking older than they could have been without this plumpness that we do for this month? And this is important, that when we inject something, we think, what will happen in 20 years? Are we not making the skin work too hard or overfilling it with the products, with these active products? And therefore, as a trehalose, it's a product that enhanced autophagy, so it will be cleaning around. Where you work, you clean around with this product. It's not only hydrating, it helps with the tissues around to get rid of an old, not anymore useful products from the earlier oxidation, stress, and so on. But we're talking about the trehalose all the time. What is this? Yeah, we can say like this. It's sugar, protects proteins and lipids, and works as an antioxidant. This is what I said. We don't need to get inside that deep because we won't use it. But what we just need to say, it increases the stability of a product, stabilizes proteins and amino acids. Why would we inject amino acids into the skin when they're not stabilized? Here we have a product that can stabilize the amino acid, and through this stabilization, what do we do with amino acids? Do you guys use the products with amino acids? So here's your natural one. The trehalose stabilizes amino acids. So we are helping our body to stabilize them, to keep them, and to build what? To activate fibroblasts, and what to build? Collagen, elastin, hyaluronic acid. So this is like a small step to encourage our body, to give a one set, okay, yeah, I will clean it all up here, I will support you, and this is what you can build through. Of course, we cannot say, if your patient is smoking, drinking alcohol every day excessively, or going on the sun on a solarium every day, of course, it doesn't matter what you do, what you inject, it's no sense. But if your patient is ready, he is not in any deficits, he has no vitamin deficit, protein deficit, and you encouraging the skin to be clear and ready, here it is. Trehalose can support it a little bit. So, as we said, stabilizes, reduces oxidative damage, which is also important. It's like a small shield that you give when you inject aqua. What helps to diminish this oxidative damage, we all, I don't know if you probably too, you guys are really good here in Malaysia with this. You probably say use sun protection or products they are helping with oxidative damage. Do you use it? Do you emphasize your patients to use the products like this, creams? For the superficial layers, of course, and this is the same here, but we're working inside of a tissue. So this is how we can go further. What is the INNEA Aqua? You all know this. And here we go a little bit back to our ground hyaluronic acid. In INNEA Aqua, we have two types of them, low and medium molecular weight of hyaluronic acid in a high concentration. This means we are already covering two of the three molecular weights range. So we are already in this table that I showed you already hydrating and starting to stimulate. Plus a trehalose, as I said, oxidative protection, repair of dermal tissue. What do we do through this? Who are we working? Who is this patient that you use Aqua with? Who is this patient? What do you think? When we want to repair, we will want to hydrate. These are, as I said, dermatological patients. Rosacea, yes, we don't have any problem. It's really soft, but it works. Hyperpigmentation. Do you have a lot of patients with hyperpigmentation? What do you do? What do you use? What product? What would you inject? Do you have an injectable for patients with hyperpigmentation? What do you do? It's okay, you can say. Polynucleotides? And how do you have a good with about membrane? Probably, yeah. I have also polynucleotides in my practice. Thing about polynucleotides is not bad, but it's working not that aggressive. So if we are looking at the patients with hyperpigmentation, in Germany or in the patient, there are more patients with melasma. And this is a really deep hyperpigmentation, if I am allowed to say this, yeah? And they are polynucleotides, I'm sorry, I think they will not help. And so we need to go a little bit deeper and to make a depot so it works longer. So this is what my patients are. Patients with melasma, for example, I do a treatment, for example, INNEA Aqua with the peelings. And this is where I work on the two levels. This is where I try to go from the two sides of it. Or patients with scars. What do you inject by scars? Acne scars, the remission, of course, acne scars. So this is from another, you are just trying to get rid of this bulge or this scar by replacing the volume. There. Here we are just, also we are of course replacing the volume with the hyaluronic acid, but trehalose would do this mechanical scar irreversible way. So we are also not only replacing the volume, but we are also trying to work against the mechanism that created it, which is also, I find interesting. And this is what I do with the patients. So this we already, wait, I'm not here with me. Genau, exactly. So what we said, this dual weight, we cover already a bigger patient's activity. So we also improve spreadability. We go through different layers and we go through different receptors. Plus, with a trehalose edited, it also extends the spreadability because trehalose makes like a small pocket. So it slows down this hyaluronidase desactivation. And this is actually a newest in vitro, this means not in the patient, but in vitro study that evaluated INNEA Aqua's effect on the keratinocyte with artificial wounds. What does it do to a fresh wound? Why do we need it? Explain later. So INNEA Aqua they took the culture of a keratinocyte, human keratinocyte, with artificial linear wounds, I'll show you, with a scratch, and treated it with INNEA AQUA on the 2 hours, treated with INNEA AQUA only once, and then checked the 2 hours, 8 hours, and 24 hours. And what interesting they found, this is a base, this is a test, this is INNEA AQUA just treated, 0 time. And this is after 24 hours test, and look, INNEA AQUA 24 hours. Do you see the difference? 24 hours. What does it mean? We need to discuss, of course, if this is for all scarring or wound makes sense, but if we are working with the patients that you already treated with a laser, will it help? Yes. How does it help? It helps the wounds to close, but we accelerate a little bit. If you're working, I do a lot of radio frequency microneedling. Does it help? Yeah. And how? This is how we want, this is how we get the wounds coming together. And this is what we see. This is the normal wound healing and wound size without anything to test. And this is with the INNEA AQUA highest concentration. This is how it's healing. So it's helping us to heal what we can do. Chickenpox, or patients that are coming with a first scar, I don't know, car accident, what do they burn? Do we do this? Yeah. Does it help? Sorry, German game. Yes, anyway, helps. So what do we see? Faster wound course control, increased hydration, and metric density. That's why it's so cool to use together with, for example, laser, radio frequency. Directly after you lasered, you inject. Of course, I would not apply it superficially. It's a product based. I will inject intradermally. You are really superficial, so you're working through your laser surface also as well, but you are helping with the metric density. Why do we laser? Why? We want these matters to be thicker. And here's help. It's faster. It helps your patient to recover faster, so downtime is less. I don't know how here, but my patient, the first question, how long can I not go to work? They're like workaholics in Germany. I'm like, what should I say here? That's why. And the faster I say, you know, I do this, but then I apply a special product. So you have almost no downtime. 24 hours, you've seen, it's already already closed. So there are also a lot of other clinical studies that they did. They also work through gen toxicity, cytotoxicity, and every single of these tests in INNEA AQUA went really well. They did everything perfect. There is no toxicities or something discovered. So the product is safe. The product is well researched, what is also important, because I don't know like here, but in Germany or in Europe, we get all the time this trends for product, and then everybody starts. And I'm a little bit. I'm always like looking, is it really? I'm asking my colleagues, and some colleagues I know already, they take everything that comes because the patient seen it on TikTok. And then, like, I don't know, have you had here this lemon bottle thing? Lemon bottle, do you know this? Okay, so this was a fat burner. I don't know where it came from, but everybody got it. And then they figured out it was not even tested really. In Switzerland, they forbidden it because we have in Germany also these chiropractors that are allowed to inject this, and everything that is without prescription they can do. So they all got it, and I asked them, and you used it, and how is it? It's perfect, it works so well. I was like, okay, I bought also one box, so I tested, doesn't work. And then I read how the others allergically reacted to this, and then we all started to research, and there are no research about it. And you're like, okay, they even didn't check the toxicity, how does it work with the dish. So it's important to work with some lemon bottle. Yeah, you can Google. It's a big thing. Was a big thing. I still have a couple of. If you need, I give you, but it doesn't work, and it's toxic. So you need to focus on the products that are well researched, and it's not something that they're talking about. that products that are investigate what they do. Also, very interesting thing here. So they tested how a combination of hyaluronic acid and hyaluronic acid with trehalose will react of hyaluronidase. We're not talking about the hyaluronics that we inject. This is not about this. Of our natural hyaluronic. So, and this is what they found, that the product that are with trehalose, INNEA Aqua, was much much more stable than the product only with hyaluronic acid. What does it mean? Of course, you're not getting bumps longer. No, it's not about this. It's about the product ability to stay in the tissue and hydrate. And this is what it's cool about. You, for the same amount of hyaluronic acid, the one without trehalose will go much faster away because of our natural hyaluronidase, and with this one, it stays longer. So it's good. It's good. You can use it. It's a little bit longer hydration, depending, of course, on the patient. This we always need to say. Genau. So we also had another test. So this one is when we use this hyaluronic, another test, and I find it really interesting. So depending on what part of a hyaluronic acid trehalose binds, it can be stopping hyaluronic acid from working. So they tested what part of a hyaluronic acid molecule it binds to, and it binds to amino groups. This means that the other active part of hyaluronic acid stays active and has no problem, so it's working, and it's working with the bones, and it will be further activating the receptors in the skin and working completely perfect. So what we also have found here, exactly, so that hyaluronic acid and trehalose complex, they're not only stable, they lose also less water, as we can see, total water. So this also shows that it's a stable molecule, that we are staying really safe and much longer as with another products. So it was too much. I find this is now enough. So this is a summarization. We are working here with a cell viability under stress, so it helps us to maintain the same cell turnover also under the stress. It helps us stabilize the protein and activate autophagy, what we were talking about, and enhances hydration, elasticity, and UV protection. What is also important is that it's, as I said, low and medium molecular weight, so we're going to different receptors types and trehalose. So it's perfect for fine lines, texture, and, as I said, photoaging, early aging signs, perfect for a very big group of patients. What do we recommend how to inject? How do you inject aqua? How do you prefer?
Using needles.
The micropapular. Yeah. This actually I like too, but I have another problem in my practice. I have patients that are sometimes driving 3 hours to me and 3 hours back. So if they just come in and I just do these micropapulars, they cannot come every 2 weeks. I have no appointments every 2 weeks. This is impossible. So that's why I do combinated protocols, so they can come at least every 6 weeks. I have appointments every 6 weeks. They can come this far away every 6 weeks because I don't do every Saturday work, no? Because they're taking usually Saturdays. So I prefer also this micropapular technique. We do really careful. Please, probably you've noticed, aqua product can stay a little bit longer papular. Did you notice this? This is good. This is nothing bad. Probably you injected too much in one papular. Sorry, but this is the amount, 0.05 to 2.01, not more than this. Sometimes I can do the whole, depending on the face, of course, the whole area. It's perfect. I can do lines here and there. Don't forget what we can use it for. The earlobes. Do you do this? It's perfect. If you have something, if his face is really small, earlobes, Don't forget this area. You can everywhere treat it with this, no? Linear threading, yeah, I don't do that often because bruises. My patients, as I say, the politicians will hate me if they come out with a lot of bruises. And with linear, I find it's a little bit not that. With a fanning technique, exactly. Cannula, I like, sometimes as use, but cannula I love to combine with. So this where I will do micropapular on cannula on the deeper layers. So in one treatment, my patients get superficial and deep. And that is what I like to combine Evidence with Aqua. Have you worked with Evidence already? I tell you why. What is the Evidence? So Evidence is something with a high molecular weight, really dense. So you cannot do papular technique, it will be impossible. And when you do the Evidence with, for example, cannula technique, you're already supporting. I like to do this really peripherally, so I support the whole lateral part, and I do papular all over. So I go deep, I support with the Evidence, and I go superficial with the micropapular, so they get lift and they get hydration, and they go. And they come in 6 weeks again. And this I do 3 or 4 times. And this is perfect. And they will see lift. They see immediately lift because it's a dense product. And hydration, of course, they will see later. But about 5 to 7 days, you already see it glowing and lift is still there. It's perfect. They love it because first they see lift because of the Evidence, then they see hydration, and then it's time to come again to me. And they are happy without this. And of course, you don't see it right away. It's accumulative. There is no way you use once biorevitalization and it's perfect. Have you ever seen a patient that has really seen results after one time? It's impossible. And I tell always, I don't do any biorevitalization without a plan. Sometimes my patients they are allowed to use their treatment to choose, and they book this biorevitalization. I don't know the patient. Why do they book that? They go, oh, okay. If they come and they just want to try, I said, no, you don't need to try. Doesn't make any sense. You spend money, I spend time, you're not happy, I'm not happy too, because it brings nothing. Biorevitalization, it's a set, it must be done a course. And when you combine, you are even higher with, I always try to lower patients' expectations, so they don't expect something that they will be coming out as an Angelina Jolie after they are not, but I tell what they can expect if they are working with the right way. So linear technique, you all know, cannula you work with, it's nothing more than this. I usually, depending on the patient, I use different, depending on the problem zones, I use different techniques, so you know how it works. This is a multiple points technique. This you know from other companies, probably you use this, yeah? Multiple points like this. The 5 points from a well-known other company technique. I like it. But the problem is, if I do multiple points and then do biorevitalization, the patient don't understand. They think, why is she injecting at the same time? Why are the 2 products? What is the difference? Is she trying to persuade me to do something? That's why when I do cannula, they see, okay, she's using one product for deeper tissue layers, and when she's using, it's another part, so she did this and she did this to me. It's also about persuasion. I find that it's really important to explain patients what and why, and that they feel it and they see it. Safety. Of course, we need always to have allergic reactions. Have never reported infections, complications. Of course, if we are doing it without our gloves and edema and hematomas also depend on the patients. No? Some patients have such a thin skin that they will get this. It's not any other. So indications, we already went through this. My patients are satisfied, especially when I combine and when I explain. I find the halfway of your success is your consultation. If you are telling something that is not, or tell them too much, or when the patient comes, you know what I need this. And I say, okay, this, I'm not a plastic surgeon. What I can help you a little bit this, maybe, if you are working with me. And this is important so they understand that it's nothing getting other than that. So, and this, what I also love, combination therapies, as I said, PRP, peels, hyperpigmentation, as we said, INNEA AQUA helps to reinforce barrier, helps to hydrate, helps to stimulate neocollagenesis. It's perfect. You can use it with every other treatment. And what I do, this is from me, so this is a patient's 2 to 3 treatments we do, about 2 to 4 weeks when you do only aqua, if you are combining it every 4 to 6 weeks. After your course, I always tell my patients it's not forever, so you need to maintain every 4 to 6 months they need to come. And we need to, here is a consultation, it's a progressive. And sometimes you make photos before, or do you have the photos? You usually make photos before you start the treatment plan, or always? Do you go with your patients then through the photos? Because sometimes I have patients, they come, you know, I don't see any difference. I don't see any difference. Unfortunately, after this 6 treatment, I don't see any difference. Okay. I'm always nervous because I like that they are satisfied because I have a big name or what. And then I opened the photo before. And I said, oh, really? And what about this? And oh, I didn't know that I looked so ugly. And I said, yeah, I don't know, it's not ugly, just we made it better. So it's about the expectation, it's about expectation. The results are not immediate. They will first see something, but it will be about 6 months. I always say we meet in 4 to 6 months if I'm ready. And then we do the next, but first we do your photo control. And then it always works. One patient didn't work, she was smoking too much. I think she was also drinking, but it doesn't matter what you put in this patient, it's not. But if you are consistent, patient healthy, it will be working. Evidence. What is with the evidence? It's a high molecular weight. We know some products like this, and this is why I like to incorporate evidence, because I don't want in one session products from one company and another. I want to be safe. In Germany, they can sue me because they're crazy. So I like to be safe and say these 2 products are working well together. I know that there will be not cross-linked reactions, and that's why I go safe. I don't do cocktails. It's not in our treatment plans, so I don't do the cocktails. Because it's, for me, in Europe, in Germany, it's not that safe. It's not recommended. And what is not recommended is not desirable to do. I go safe, I go evidence deep, and I know that it will be working good with the aqua on the top point. I know that nothing happen. So I do with a high molecular weight, hyaluronic acid evidence, lift, as I said, and I do hydration on the superficially. Also, I do the linear technique. You can decide how you want. You can do also the point. You can also do décolleté and neck, chest area. You can do also fanning technique. As I said, I'm not a great fan of it. I find it's too many bruises are coming through. But so this is actually my patient that didn't see a lot of difference. Photo is not that good. Sorry, maybe you don't see also. But where do I turn the light? I think it's a little bit, so no, you don't see that good. Okay, I will explain you. There were 3 evidence and aqua on the top. So if you see, look how the cheek region looks like. Do you see that it's much smoother here? Because I see in my computer, I need probably to show you the computer. So the patient, when she saw the before and she said, yes, I see the rod. She's young, but she's also Slavic like me. We have a big problem because we have everything goes down. And when it's too late, it's too late. You cannot do too much. So you need to do it right away. And I know that in Asian people it's also, you are looking perfect until the menopause. And then it's too late. And then, yeah, so you need to start with 40, at least, better with 30, already working with your skin quality, with the lifting, and then it's too late. Exactly. There is also INNEA Classic. Sometimes when the patients are too new, too careful or something, I work with them. This is a medium molecular weight. We expect nothing too much, just a good biorevitalizant. I start with this and I show you how I work sometimes with this. This is just good regeneration, nice and slow. Moisturizing, really good biorevitalization procedure. For young people, we can work really good. And this is more with the classic I use in the protocols where I combine treatment. I'll show you also. You can do picotage technique with this one. Do you know picotage? Have you used it? So this is a technique, a little bit complicated for the patient to understand why, but you choose the most problematic area and you make about 10 points and you go pretty deep inside and give like a small bolus. And then this technique I will not use alone, because when you do at the same time the same treatment, but if you say the patient have, like me, a problematic middle face, you can use once Evidence, for example, once picotage, so you go from the other sides or from the different layers into the problem. So you have this support. Exactly, micropapular you can do also. We have this orbital rim, you know, but if you have a patient with no swelling, I use it also on the under eye. It's okay. Of course, some people are more prone to swelling. You need to be careful, of course. Probably you guys need to be careful better. And this is from a colleague from Russia. This is also how, yeah, this is not the good quality, but just a good biorevitalization, basic biorevitalization, and good also to combine, and I'll show you how. This is again about the full spectrum. When we have product of different molecular weight, we can combine them and go on all the receptors, and that's what I like because it's well researched. You can not do anything wrong with this. So optimizing, as I said, I always make a roadmap. I have a plan, and this is how plan can look like. I'll show you. Here, it's too much, no? And then we go a little bit less. So look, this is a pretty easy plan. You have a patient, 25, 35, you look what type of patient this is. With a normal, probably I will be just biorevitalization with a classic. This red one is a classic INNEA, no? You just do this, just normal protection, prevention. If it's already a dehydrated skin, not that I don't see any patients with 30 with dehydrated skin or damage. What do we mean here damaged? Acne, post-acne. Of course, not acute acne, please. Post-acne or photo damage. Or the sun damage. I don't know. Do you have a lot of sun damage? You are pretty good here, I think, no? Because in Germany, they go to Malaysia, the Germans, burn their skin really bad and come to me with all the points of hyperpigmentation. And then what do? I do this protocol. It's something that you can do. I like to work with the combinations on the patient, see every time the other products also, but and the fact you can use just INNEA AQUA also in different point techniques. For example, these I use a lot with the damaged skin for the middle group of patients, 35, 45. I do, for example, I start with a picotage with a patient like me. Then I do multiple point technique 2 weeks probably later. Then I do again multiple point technique, and then I do again picotage. This is when the problem here. And then you can do some, usually a little bit earlier. Then in 4 months, I do also with the Evidence deeper. So you go from or every side. And usually I combine. I don't have this time. Patients don't have this time. They're numbing. This all takes time. I get my money. It's all business. Yeah, we also get. I get my money. I spend less time. My room is more available because I have just 2 in 1. It's all about this. It's all about our time. We need to talk about this. And this is the one for advanced age. There I would work probably more with Aqua and Evidence. And almost every time I just do a combination. And then somewhere a little bit later, I do a collagen stimulation with the Lenisna or Radius. And then it's perfect. I can show you some photos later because I didn't put, because it's another product combination. But sometimes I have such a good result with this that it looks like I had a plastic surgery done. This is ridiculous how this all can work. You just need to find the right patient. That's it. I hope it was not too long.